Hello and good afternoon, everyone. I'm Shilpa Ray from Karolinska Institute, and I'm really glad for this opportunity to present my work in this forum. So today I'm going to discuss about the alterations in the gut microbiota of HIV-infected patients under antiretroviral therapy. So we are well aware that about 38 million people are living with HIV globally, and more than 50% of these individuals are under antiretroviral therapy for a better life expectancy. However, we know that HIV is associated with microbial translocation and gut dysbiosis, which is usually not restored back to the normal condition after these treatment strategies. Rather, it gets much more aggravated. And this disruption of the gut microbiota composition by the antiretrovirals has always remained an open question in HIV research. And this is what we are trying to address in our present study. Our study is a longitudinal cohort where we have done 16S rRNA sequencing of 16 viremic patients before and after 1 year of effective antiretroviral therapy. And these patients have been divided into two groups after therapy on the depending on the type of the treatment regimens. So it's a nucleoside reverse transcriptase inhibitor, either with a non-nucleoside reverse transcriptase inhibitor or a protease inhibitor. So after the sequencing, we wanted to investigate if there were any changes in the bacterial diversity and the richness in patients after the antiretroviral therapy. And we observed that basically there was no significant changes in the alpha diversity of the microbial communities in the fecal samples of the patients after the treatment. So interestingly, we observed a dramatic change in the gut microbiota composition of patients after antiretroviral therapy, basically at the phyla, family, and the genus level. A total of 139 bacterial genera were identified, and the picture here thereby depicts the taxonomic composition of the microbial communities, which were either depleted or enriched in patients after the antiretroviral therapy. And the overall summary indicates that the bacterial genera of Prevotella, Lactobacillus, Ocelospira, and Bifidobacterium show a significant decrease in the abundance in HIV-1 patients after the therapy. So, if there is a decrease in the beneficial bacteria, which is like Lactobacillus and Bifidobacterium in patients after therapy, does this indicate a healthy microbiota? So, in search for our answers, we further wanted to investigate if the different treatment regimens had an impact on the alpha diversity of the microbes in patients. And to our surprise, we found that the patients which were treated with non-nucleoside inhibitors showed a significant decrease in the microbial diversity and richness after therapy as compared to the ones which were treated with protease inhibitors. So after looking into the alpha diversity, we were also interested to investigate the effect of different treatment regimens on the gut microbiota composition. So at the family level, we observed that the two treatment groups showed decreased abundance of Prevotellacea and increased abundance of Enterobacteriaceae family in patients treated with the respective ART regimens. And the patients with the protease inhibitor treatment showed an additional decreased abundance of Lactobacilli family after 1 year of effective therapy. So similarly, in the genus level, both the treatment groups show a significantly reduced abundance of Prevotella at the end of 1 year of therapy. And Prevotella is known to be a driver in HIV-induced inflammation. In addition to this, Lacnospira and Ocelospira also show reduced abundance in the patients treated with non-nucleoside inhibitors. An interesting observation other than this was the patients which were treated with protease inhibitors showed a significant depletion in the lactobacillus population after 1 year of therapy. So these overall results indicate that different antiretroviral regimens impact the gut modulation in the HIV infected patients. Hence, to further validate the in silico analysis, we further wanted to investigate the direct effect of antivirals on the gut microbes in vitro. Thereby, from all the 15 antiretrovirals which were experimented in lab, zidovudine showed to have antimicrobial properties against Bacteroides fragilis, Prevotella, and E. coli. Against Bacteroides and Prevotella, the minimum inhibitory concentration of zidovudine was around 4 to 8 microgram per ml, and against E. coli, the MIC of zidovudine was much lower, around 0.5 to 1 microgram per ml. Similarly, efavirenz also showed to have antimicrobial properties against Bacteroides fragilis, Prevotella, and Enterococcus. And the MIC of efavirenz against Prevotella and Enterococcus was around 16 to 32 microgram per ml. And against Bacteroides, it was much higher, around 128 microgram per ml. I would like to mention here that when we are using the concentrations for testing the activity of antiretrovirals on gut microbes in vitro, we are trying to mimic the gut concentrations of the drug, which were actually calculated on formulations based from European Medicines Agency. And these calculations determine that the gut concentrations of the drug are much higher than what is the concentration present in the plasma. The table on the left-hand side of this presentation shows the combination of antiretroviral therapy, which uses efavirenz and zidovudine to have possible antimicrobial effect on their respective microbes. On the right-hand side, the table shows the MIC50 and MIC90 values of zidovudine and efavirenz, which are the values inhibiting the growth of 50% and 90% of the isolates which were tested in this experiment. So with this, we come to the conclusion where I would like to mention that the longitudinal design of this cohort helped us to understand that antiretroviral treatment alone cannot restore the gut microbiome changes in the HIV infected patients even after 1 year of effective treatment. So more research is required on this topic in order to develop better therapeutic interventions and improved gut health. Secondly, I would like to mention that this study also provides us a proof of concept about the antimicrobial properties of two basic antiretrovirals, which is zidovudine and efavirenz. And these two antiretrovirals are basically used or commonly prescribed in low-income countries, but also in high-income countries like Sweden. Zidovudine is used during delivery and during the first weeks of postpartum. So this not only raises the issues about HIV treatment, but also doesn't rule out the possibility that these antiretrovirals can impact the gut microbiota of HIV infected patients through their antimicrobial property. So with this, I would like to thank Piotr Novak, my supervisor, for his crucial support throughout my postdoc career. I would also like to thank Anders Sonebari, Ujjwal Nyogi, and the respective groups, as well as Christian Giske and Ashwati Narayanan for their help and support during work. I would also like to thank the funding agencies for supporting our work. And last but not the least, I would like to thank you all for your attention.